In your initial response to this question, First Minister, you referred to the other health professionals who can play a role in alleviating the pressures on GPs themselves. You may be interested to know that I visited only last week with Jonathan Lloyd Jones in the Caerau Surgery, the Caerau Pharmacy. It's a pharmacy at the top of a very disadvantaged area, very much that issue of the inverse healthcare law. But what they're doing up there is working with a new community pharmacy contract in Wales. And I have to say, I sat there with individuals' permission, I sat in as they did minor ailment diagnosis and prescribing, and took that pressure off the GPs, but were liaising directly with the GPs and sharing the data information as well with the patient's authority as well. What a way forward that is. So can I ask him for his assurance that we'll keep on exploring these innovative ways, not only to relieve pressure off GPs, but also to promote the health and well-being of those in some of our most disadvantaged communities?
Well, shall we thank Huw Irranca-Davies for that question. I think the promotion of community pharmacy has been something which has been agreed across the chamber here over the whole of the devolution period. We've always believed that it was a resource that could be made more of, and over the years we have seen community pharmacists in Wales absolutely expand the range of services that they provide, to agree to modernisation of their contracts, to make sure that the services that very highly trained workforce is able to provide as part of the primary care family is available right across Wales. And, I think it's a real tribute to the people who work in the sector that they have been so willing to play their part in the modernisation of the service in Wales. And I'd say this, Llywydd, that in Wales we continue to have, I think, just over 700 community pharmacists. They're on high streets in every part of Wales, whereas in England there has been a significant decline in the number of pharmacies. And that is because the regulations passed in this chamber have protected the high street position of community pharmacies, allowing examples like that highlighted by Huw Irranca-Davies to thrive and expand. And it's not just community pharmacists either, Llywydd. Thinking of the original question, I was visiting a GP practice in the last few weeks. They were celebrating the fact that they have just recruited a pharmacist to come and work directly in the surgery, and were explaining to me the number of repeat visitors that they will now be able to have seen clinically appropriately and quickly by that extra resource. So I entirely agree with the point that was made, both in the community and directly within primary care. The contribution of pharmacy is fundamental to the way we shape the service for the future.